Hey everybody, welcome back to Ask Dr. Dan. This week we're going to be talking about knee osteoarthritis. Osteoarthritis is a degenerative condition where the cartilage in the joint wears down over time. The knee is one of the most common places where this happens. About 1 in 7 people will experience pain due to knee osteoarthritis. What happens is the once smooth joint, as it wears down, becomes rough, which then causes inflammation. That inflammation causes pain, swelling, sometimes fluid inside the knee. Now, we used to think of osteoarthritis as a simple wear and tear condition, kind of like a tire on a car where the tread just wears down over time. To some extent, that's true. However, there are other components to arthritis that factor in as well. So the inflammation actually feeds into the arthritis. Those inflammatory cells actually start eating away at the cartilage like little Pac-Men and continue to speed up the arthritic process. Also, in a good healthy joint, we have a natural lubrication, something called hyaluronic acid. With arthritis, as the tissues wear down, we don't make that lubrication anymore, so that causes a dry joint, which causes more friction, more rubbing, and again, further speeds up the arthritic process. Other factors, such as being overweight, will definitely contribute to increased arthritis. Some people are just genetically more prone to osteoarthritis. And then if people have had a bad injury to the joint, either sports or an accident or anything like that, you're much more prone to getting arthritis in the joint. When you come into the office, on physical exam, what we'll normally see is pain along the joint lines when we push, sometimes decreased motion, especially with flexion in the knee. And then with that range of motion, we also feel and hear a lot of clicking and crunching, something that we call crepitus. Also, X-rays will show arthritis very easily. What we'll see on the X-ray is a decrease of the joint space. So the joint space that was once like this is lower. Sometimes it's even bone on bone. We will also see bone spurs, and we will also sometimes see little cysts underneath the bone. That's usually with more advanced arthritis. Treatment options vary from very early on, trying things like physical therapy, ice, some anti-inflammatory medications, a brace for support and compression. If that doesn't work, things like a steroid injection may be tried. If that doesn't work, there's actually a treatment where we actually put some of that lubrication back in the joint. It's usually a series of injections over a couple of weeks. Past that, where we've had great success is with regenerative therapies, using things like PRP or stem cells to help facilitate healing and getting rid of that inflammatory process. And if all else fails, you can consider a knee replacement. However, with regenerative therapies, many people can avoid that now, and as regenerative therapies continue to advance, hopefully knee replacements will become a thing of the past. So that's it. We're going to be taking your questions over the course of the week. I hope you have a great week, and we will see you on Friday. Remember, don't operate, regenerate.